Healthcare is complex, and sometimes, despite our best efforts, things can go wrong, and patients may experience harm as a result. There are many reasons why things can go wrong during a patient's healthcare journey. Whatever the reason, it is important for us to acknowledge what has happened to the patient and to talk to the patient to help them understand. Open disclosure describes the open, honest, empathic, and timely way we communicate with patients when things go wrong. The HSE is committed to the principles of open disclosure and has a policy on open disclosure that promotes a culture of openness and transparency across all health and social care services. Open disclosure improves patient safety and quality of care through organizational learning. It reflects the values we aim to live every day in our health services. Open disclosure involves talking to the patient as soon as possible after the incident, acknowledging what has happened, saying we are sorry, being transparent by not holding any information back from them, and treating them with compassion and empathy, the way we'd expect ourselves and our loved ones to be treated. Effective open disclosure requires an open, fair, and just culture, where staff feel safe to report incidents and are not blamed when incidents occur as a result of system failures. Open disclosure is also about supporting staff to learn when things go wrong and to take steps to try to prevent a recurrence of the situation. Open disclosure benefits patients by rebuilding their trust and confidence in our services. It reassures them and their families about their ongoing care and organizational learning. It also assists their emotional recovery following the event. The Medical Protection Society has developed the ASSIST model as a tool to guide our communication with patients during an open disclosure conversation. During the conversation, we should acknowledge what happened and the impact. Say sorry. Hear the patient's story. Give the patient the opportunity to ask questions. Work together towards a solution. And travel together with the patient on their healthcare journey. When things go wrong, this can have an impact on staff too. And it is important that we support each other. There are a number of resources and services available that can help you. Open disclosure is the professional, ethical, and humane response to everyone involved in an incident. It's about doing what's right.
husband died of sepsis following a bowel operation, and it was a very unexpected outcome because he had no other health conditions. So for him to die within 3 days of his operation was an absolute total shock. I feel that I was expected to just accept that sepsis was an unfortunate outcome of his operation, and I needed to have answers around what actually happened to him. A month later, when I met with the surgeon, and he disclosed to me that my husband's operation had clashed with an on-call situation where the team were covering on-call as well as doing my husband's elective surgery. I had huge issues around that, and I just felt that that issue had contributed to my husband's sepsis, and I just had so many questions. Instead of being supportive of a bereaved family, I felt they were starting to treat me like as if I was a potential risk to them. Everybody needs to have an understanding that so many people are damaged in the fallout of these adverse incidents, and everybody has the right to be supported. So to be bereaved in a healthcare incident, it adds a whole new layer of grief. And if you're left floundering around for years on your own, I think that just compounds, that creates more harm. It's an additional harm to the family. The culture is changing to one of acknowledging, supporting both the patient and the medical person involved. I've been witnessing this policy evolving over a number of years now, and I know it's been catapulted into a whole new level of awareness in the last year. But I actually welcome the policy, and if it's fully implemented, I'd like medical people to give it a chance, and I think patients should give it an opportunity to work as well, and to trust that there is now a good mechanism for making this part of our culture. We just want to get to the truth and be supported in getting to the truth.
I was a paediatric staff nurse and part of a retrieval team dispatched to a general hospital to pick up a critically ill 10-day-old baby. After we arrived, our team doctor secured an arterial line, which wasn't labelled. The baby went into cardiac arrest and I was instructed to administer adrenaline. Baby's arm turned from pale to blue. I realised what I'd done. I'd accidentally inserted the adrenaline into the arterial line. We stabilised the baby and got it back to the receiving hospital safely. I was sent home, alone. I was distraught. I could lose my career that I loved. I couldn't think straight. I was suicidal. No one from work contacted me, and I was afraid to contact the unit. I was still shaking when I returned to work for my shift 2 days later. "Do you know what you've done?" my senior manager said to me as I stood crying in the open office on a busy corridor. I went back to work. But to my shock, I'd been assigned to care for the same baby who was still on life support. I took a deep breath and went into the room. To my surprise, the mother hugged me and thanked me for saving her daughter's life. This didn't feel right, though. Didn't they know what had happened? I certainly didn't feel like a hero. I realised they weren't told the whole story. The parents don't need to know. They're vulnerable enough, the consultant said. I insisted. It was the right thing to do. Mum and Dad understood. Baby was safe. That was all that mattered. A success? For Baby. And thankfully, she received the treatment she needed quickly to save her. But for me, I eventually got the support I needed from my senior manager when she realised how the incident and her behaviour had affected me. No one said anything to the doctor. The baby's mum kept in touch, sending me cards and photos of baby growing. This was a lovely gesture. It really lifted my spirits to see her doing so well. I slowly began to regain my confidence, and I have had a successful career. But I look at success in a different way now. For me, there were 2 victims in this incident. My 2 days alone and what happened afterwards still stays with me. Why was I sent home? Why didn't someone call? Why wasn't I supported at the time? Did they think I'd forget about it? I didn't forget about it. I was broken for a long time. But why did it have to be that way?